Hey Noah, how are you?
I'm fantastic.
We are going to have an excited day today.
Looking forward.
I know you are helping us a lot.
Thank you. My pleasure.
Now the most important thing you should understand is I'm the boss.
Sure, boss.
And I'm going to take your help to do the surgeries.
Okay, boss.
So welcome to the program, Dr. Sunil sir, and it's a pleasure to have you.
Thank you, ma'am.
So have you ever imagined that one day when you become a doctor that you would be working with robots or vice versa?
Frankly speaking, my main interest is engineering. It was, I would say. But as it was a family of doctors, as a child, I was asked to take medicine. But ever since I took medicine, I was always interested in these gadgets and also these new computer things and all. That's why I chose orthopedics. Orthopedics is the area where we can have, the new innovations coming in. And that's why I started off with computer navigation first. So that was the initial starting off in this joint replacement. Following that, now we are into robotics.
Now I guess you're enjoying a mix of everything like.
Absolutely. That's my passion now. My work is my passion. Even though I work very late in the night, I don't get tired. That's purely the fact that I enjoy my work.
These days, knee arthritis is the most self-Googled diagnosis that people make themselves and come to you. Is that a fact?
Absolutely. I mean, if you see now Google, Chat GPT and all, a lot of people are asking for treatment and you won't believe. See, in my practice also I've seen change a lot because people are coming a little bit educated now. Earlier they used to, when I say you need a knee replacement, they used to say, okay, and what is the recovery phase and all. But now they're asking me in particular what type of implant I'm putting and whether I'm doing robotic or not. And also what type of suture material I'm using. Will it be a scar? So these are the things, one way it might help people if they look upon because they have done their homework when they come here. So it makes our life easier.
But why do you think that knee pain is so common once you hit a certain age, 40 or 50?
Everything is in your hands now. You don't want to put even 2 feet to the kitchen as well. So there are days that they'll come and put in your lap. Early days, if you want to go to the market, you do a bit of walking. And if you take our fathers or grandparents' age group, they used to walk a lot. But for us, now people have become more of couch potatoes. The reason being, they are into their targets. So they're sitting there for 12 hours a day, continuously almost, with probably a 10-minute break. So they don't realize that they are punishing the muscles and their body. Because movement and weight bearing, these are the two main things that will make your bones stronger as well as your muscles.
I think you've rightly explained, and also sitting is the new smoking under roof. So talking about knee arthritis or knee replacement surgery, doctor, robotic surgery is the buzzword. So what exactly is a robotic surgery?
I want to put it in a simple way. Earlier days, when we used to construct a house, we used to take a blueprint. So you have a blueprint on a paper and then according to you get the house built and then looking at the house, if you don't like some areas, you don't like this wall, for example, you break the wall, put a window, change everything. So that takes a lot of time, energy and money. But now currently the architects are giving you a 3D video wherein you walk through the house, you look around, see how it is, even including the furniture. So everything is planned even before you put your foundation stone. Similarly, in orthopedics, when we do joint replacements, it is called conventional. So when we do that, what we do is first make cuts in the bone, which to put the implants on, and then we try to balance. Sometimes if the balance is not good, again I have to take it out, again make some more cuts or do some ligament balancing, all these sorts. So that's going to take a lot of time. Whereas here in robotics, first I'll mark the bones. The robo will create a 3D image that I'll see on the screen. Then using the robotic tool, I do the cutting. Now a lot of people are under the myth that the robo does everything. Like as if we see in the movies, robo will walk down to the table, do the cutting and then go off. It's not true. Actually, we have the machine there. We are using the technology. The beauty about this is it is continuous and a human eye can't identify up to 2 degrees. Even if you put a straight line, it might be in 2 degrees, but you can't identify. Whereas a robo can identify.
Yes, boss.
So that way we are putting the implants in more precise manner and the ligaments are well balanced all through. Sometimes you see these knee replacement patients coming back with conventional method. They come back to us with the knee wobbly. That's because the surgeon who has done, I mean, some people are of the notion that, chalo, my senior ho gaya hu, chalega. Chalega mane, you put the implants and they say, okay, that will settle itself. It's like you're accepting some part of failure. Whereas in robo, all through the range of movements, we check the movements, make sure it's stable.
So the surgeon is still the master in that.
Surgeons are always my masters.
Surgeon will be the master forever. So for an AI to identify, to make cuts and then do appropriately is difficult. Here, what am I doing? I'm opening the joint. I'm marking the joint for the robo to make a plan.
Is there a possibility that in the middle of the surgery, the robo can have bad mood swings and can stop working? And then what's the plan B?
I'm not human, so mood swings don't apply to me.
Luckily, it's not a human, so mood swings are difficult for it. I urge all the orthopedic surgeons who are interested in doing robotics, first get your basics right. The reason being, you need to have a backup plan, always plan B.
So what are some actual benefits that a patient will be getting if operated by a robotic surgery? I mean, are there any difference when compared to the conventional traditional surgeries?
You asked a nice question. Rather than some, I would say a lot.
I'm fantastic.
The reason being, first and foremost, everybody is frightened about is pain. See, what we are doing is we are making the cut smaller, and also the inside cuts are much less, and also the bone cuts. We don't do the unnecessary bone cuts, and also we don't enter into the bone where a lot of blood is coming out. So at the end of the day, the swelling is much less, pain is less, and also you get up and walk within 3 hours. That's the beauty. And within 2 days, you're discharged from the hospital. And majority, because they're well balanced and recently developed implants, we also can sit down. And also the recovery is quicker. You're out of the hospital quicker. And also the physiotherapy. We usually suggest 1 month physiotherapy post robotic joint replacement, which is much, much easier. You can participate, and within 1 month, you'll get full range of movements. And I have seen myself, a lot of my patients coming back to me normally walking within 2 weeks. So we go a methodical way, and also don't believe these false advertisements. Robo is fantastic. If it's my knee, I would definitely get it done.
That's very well said, and I'm sure most of the doubts what people will be having are cleared with this.
Thank you.
Now let's address the elephant in the room. What about the cost factor when compared to the traditional surgery?
That's a nice question you put. I would always say it's in thousands. Okay, not very much. All of us can afford it. And my sincere suggestion, you don't have to come to me, but go to a robo surgeon. You are spending for yourself. Whereas if you have all the jewelry on your body, you are spending for somebody else. I'm putting all the jewelry to show off to my person in front, saying I'm so rich. But I want to be rich in my health. I want beautiful joints that go at least 20, 30, 40 years. But our main aim is we want to do the first operation to be your last operation. So you have to be wise. Don't keep bargaining. See, always when you bargain, you're getting a cheaper alternative. And you see advertisements saying people can do with so much, very less packages and all. Why do they keep less packages? Either they don't have work or they don't know how to do. They're learning on you. So you're paying to them so that they learn on you. So you're going to be the bakra. And also, sometimes they put cheaper implants saying they're doing the best one. So this is like automobile. I keep telling my patients, when they come, I give them options, a range. I don't say this is the only option. I give them a range. And when they say, what is this? This is like an automobile. It has to run longer. See, first and foremost thing, knee replacement is a must. You should understand that you have to live on your own till your last day and go to the washroom. We don't want anybody holding you, lifting up in your last days or last years.
Looks like by the time we finish this podcast, people are waiting outside to get a knee replacement done by you. So tell me honestly, what's more difficult, doing a podcast or convincing patients to get the knee surgery done?
Well, podcast is just one way answer, isn't it? Whereas this one, convincing a patient, sometimes I feel bad. I get people at the age of 85 literally begging to have a knee replacement. See, the most important thing what people should understand is all of us age, whoever we are, whether we are a minister or pauper or whatever, we're all human beings. We are going to age, so they're going to age-related changes in your body, including your organs. So if you come to me, let's suppose at 80, you are unable to walk, and you come to me saying, do me knee replacement, and I have so much wealth, I'll give you whatever you want. But I don't do if you're not fit enough for surgery. The only reason I don't want to lose you. Okay, so I might turn you away saying, you're not fit for surgery, I'm really sorry.
So, what are some of the common myths that patients usually have on their minds when you say robotic surgery doctor? I'm sure the first one is whether you do the surgery or the robot.
I'll tell you a funny one as well. One of the patients came and said, who should we pay? You or the robo? So either way, it's coming to me. That's a different story. So these are the common things who would be operating. So I would be operating using the robo. That's number one. And all through, we have a check. And I have the control over the robo, not the other way around. And also, people say this is something very new. We don't have enough literature. It's been there for almost 5 years. But I can say robo's father was computer navigation, which has been there for the past 20, 30 years, almost 30 years now. We have enough evidence to say if we plan it properly using either a computer or a robo and put the implants in perfect position, it's going to last longer.
Do people also ask you, because of the implants, does the human body reject it over a due course of period?
Few people ask these questions, and also they come prepared with the type of metals. So the commonest question some people ask is, if I put this implant, it seems I won't have infection, which is again false.
It's a false advertisement.
Infection is not to do with your implant. Infection is to do with the surgeon, the hospital, and yourself.
And also, is it possible for someone to undergo both the knee surgeries at the same time by robot?
Yes, we can do by robo and conventional both. My personal choice is not to go for both.
But why?
There are papers, and also there is what is called stratification criteria. Whom to choose? We have a table wherein we tick box, and if the patient is suiting into that, I can do. I do bilateral. The personal choice is not to do both at the same time because I don't want to put too much pressure on them, on the knees, giving them pain. A lot of people, when they ask me to do both, first question I ask is, if it is like you're wasting time tomorrow, are you going to eat tomorrow's meal today? A lot of people ask me, kar do na. So I say, then try and eat. Why can't you eat? Because your body can't take it.
So do most of us say, I should have got the surgery done earlier? I mean, what's the biggest change that they see after the surgery?
I was surprised with one person. After I have done the knee replacement, 6 months later, he was climbing the trees. His occupation is that. You have to climb, toddy guy. So I got this video and I was really shocked. So we could give his life back. So that's the whole idea. However long you're going to live, you have to live happily and decently. That's the most important thing.
And finally, Dr. Sunil, what is that message you would like to share with the viewers out there as far as robotic surgery is concerned?
Frankly speaking, I want to say be clever. So not only robotics, for any field of medicine. See, you always feel that you're being squeezed by the corporate hospitals, which is not true. Why are you spending a little bit more compared to nursing homes? Because they're investing heavily. They're bringing the topmost technology from abroad to India. You're so lucky you're in India. I am also. Because I worked in London for 10 years, I know the difficulty. If I want to contact my general practitioner there, it's going to take 1 week. If I want to see a specialist, it's going to take 2 months. If I have to have my surgery, it's going to take 4 months. What should I do in the meantime? Should I struggle with pain? Here, the beauty of India is you can contact the doctor the same day, have appointment within hours, get treated within hours. So you have to be wise. Treat yourself early. And with regarding to robotics, I would say if it's my family, I would blindly do robotics.
That's great.
The reason being, you're spending what? Thousands, minimal, but you're getting benefits at least 100 times more. So I'm hoping, let's see, right nowadays we are having big machines to do this robotics.
I'm not that big.
I'm hoping in future we get smaller machines which are portable so that we can take this technology down to tier 2, tier 3 cities as well. So that is our aim. We want to give the best possible orthopedic care all over the country. Even if it's a village as well, they should be able to get this access at the earliest and with the minimal cost. That's our aim.
So I think you've said it all and you've said it brilliantly. So thank you for such an enlightening and informative episode.
Thank you, ma'am. Thanks for having us. Thank you very much.
Thank you.